All right, welcome back, drivers. My name is Tandra from TS Hill Logistics. The last time that we spoke, I went over three of the biggest reasons why truck drivers have depression. This time around, I actually want to go over some warning signs and how you can assess yourself to see if you might be experiencing depression or anxiety. This video is intended for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always check the advice of qualified healthcare professionals when it comes to questions about your mental health. Okay, let's dive in. Now, here's something that might shock you. The FMCSA requires mental health screening during DOT physical examinations every 2 years. Medical examiners must determine whether mental health conditions are affecting the safetiness of the driver and the people on the roads. Research shows that depression in drivers is more likely to cause accidents by 2.6 to 3.6 times. Now, here's the problem. Let's think about this logically. If you only check something every 2 years, how accurate is it going to be? Mental health isn't like blood pressure where it stays relatively stable, especially in our industry with all of the stress. Research on medical interval screening shows that mental health conditions can emerge, peak, and potentially become dangerous in between screening periods. It's like checking your tire pressure every 2 years after driving 125,000 miles. A lot can change in 24 months. Financial pressures can hit, family issues may arrive, your own health issues might go awry, and isolation might take toll. None of this waits for your next doc physical. The simple truth is, if you're screened only every 2 years, you could be struggling with serious depression or anxiety for 23 months and 29 days before a qualified medical professional might even know about it or be able to detect it. That's not safe for you or for anyone else that's on the road. So I'm going to actually go through some warning signs that you can look out for to assess whether you or anyone that you care about or work with might be struggling with some symptoms of depression or anxiety. I'm just going to read them right off of the list here, so just bear with me. So some physical changes that you can look out for is persistent fatigue that doesn't improve with rest. Changes in appetite, whether someone's eating too much or not eating enough. If they have sleep problems, insomnia, if they're sleeping too much or not sleeping enough. If they have unexpected headaches and muscle tension. If they're neglecting their personal hygiene. Now, for behavioral changes, you want to look at things like increased irritability over very small things, social withdrawal, not engaging with people at truck stops, maybe not even answering and replying to text messages and phone calls from family members and friends, difficulty concentrating while they're driving, missing exits, speed changes, traffic signals, a declining work performance, substance abuse as a coping mechanism. And some mental changes that you can look out for are persistent feelings of sadness, hopelessness, or emptiness, loss of interest in things you used to enjoy, feeling worthless or like a failure, excessive worry about work, finances, or your personal safety, and thoughts of feeling like you're better off if you're dead or if you want to hurt yourself. Now, if you are exhibiting several of these symptoms, I suggest that you just stop watching this video and call 988. That is the National Suicide Prevention Lifeline. As a person that struggles with depression myself and anxiety, actually, I do these videos to try to help people like myself that I was a little ashamed about it initially, but realizing again, it is a disease that needs to be dealt with. It's not something that you need to be ashamed of. It's not something that you need to avoid, especially. All right, so keep yourself safe out there. Now, let me introduce you to two scientifically valid assessment tools. They're used by professionals worldwide. You can actually use it to assess yourself. So, one is called the PHQ-9, and that measures depression. The other is called the GAD-7, and that measures anxiety. These tools were developed by Dr. Robert Spitzer from Columbia University in the New York State Psychiatric Institute, along with Dr. Kurt Krowinski from Indiana University Regent Street Institute and Dr. Janet Williams. These aren't random internet quizzes. They're backed by rigorous medical research and used by healthcare systems globally. The PHQ-9 screens for depression, and it takes 3 minutes to complete. It has 88% sensitivity and 88% specificity, meaning it correctly identifies depression 88% of the time, and it correctly eliminates depression 88% of the time. The GAD-7 screens for anxiety disorder with 92% sensitivity and 76% specificity. Both tools have been validated in multiple studies using thousands of patients and are used by the VA, major hospital system, and primary care practices national. So now I'm actually going to go through each assessment that you can take. Again, that is the PHQ-9 and the GAD-7. So first thing that we'll do is we'll go over the scoring system. These assessments are going to ask questions regarding the last 2 weeks. Okay, so if you haven't experienced any of these questions at all in the past 2 weeks, you're going to give that a 0. Okay, if you've experienced any of these questions several days in the past 2 weeks, you're going to give that a 1. And if you've experienced any of these questions more than half of the days in the past 2 weeks, you're going to give that a number 2. If you've experienced any of these questions in the past 2 weeks nearly every single day, you're going to score yourself a 3. So now we're going to go over the depression indicators, the PHQ-9. And I'm actually going to go ahead and walk myself through the PHQ-9 because I do suffer from anxiety and depression. So I thought, I might as well just go ahead and take the survey. So question number 1, do you have little interest in driving or other activities you used to enjoy? So for me, over the past 2 weeks, that would actually be a no. So I've been doing good lately. So I'm actually going to give myself a 0 on question number 1. Okay, question number 2. Feeling down, depressed, or hopeless about your situation? Well, feeling down, yes. Depressed or hopeless, no. So over the past 2 weeks, I am going to go ahead and give myself a 1 in that category. Trouble falling asleep, staying asleep, or sleeping too much in the cab. Give myself a 1. Okay. Feeling tired or having little energy or even rest breaks. So for me, that's over several days. So I'll give myself a 1 there. Poor appetite or overeating at truck stops. So number 5, I'm going to give myself a 1. Feeling bad about yourself or that you're a failure as a driver or a provider. For number 6, I'm going to have to give myself a 1. Trouble concentrating on driving, doing paperwork, or even on conversations. For me, that's going to be not at all. So I'm going to give myself a 0 for number 7. Moving or speaking so slowly that others notice, or being fidgety or restless. I'm going to give myself a 0 on that. That hasn't really happened lately. Thoughts that you'd be better off dead or thoughts of hurting yourself. That's question number 9, and I'm going to give myself a 0 for that. Okay, so the way that it works with the PHQ-9 is that if you score a 10 or anything over, you want to get yourself some help. Let's see what my score is. I have 1, 2, 3, 4, 5. Not bad. I'm halfway through, but I also do have a therapist, and that tends to help me a lot. And I do things like journaling, so yeah. So that was the PHQ-9. Now we'll go over the anxiety indicators, and the anxiety indicators again are the GAD-7. So it's the same scoring system. And here I want to stop to just mention as well with the depression PHQ-9. When you get done scoring yourself, there are some score points that you would want to know. So if you scored between 0 and 4, you have minimal depression. If you scored between 5 and 9, you have mild depression. And again, like I was saying before, anything over 10, you just go ahead and get yourself some help because you're worth it and you deserve to be better. So these are the anxiety indicators. So over the past 2 weeks, have you had feelings of nervousness, anxiousness, or have you been on the edge while driving or resting? For me, that is going to be no, so I'll just do a zero. So, over the past 2 weeks, have you not been able to control your worrying about money, safety, or work? Um, I'll say for myself, over the past 2 weeks, there was some days, so I'll give myself a one. Number three, worrying too much about different things, loads, schedules, regulations. I'm going to give myself a one for number three. Having trouble relaxing, even during downtime. I can give myself a one for that question, which is number four. Being so restless, it's hard to sit still in the cab. I don't have a cab, but I'm going to give myself a zero for that. Number six, becoming easily annoyed or irritable with dispatchers, other drivers, or family. Easily irritable, I'm going to give myself a one. And last question, number seven, feeling afraid something awful might happen on the road or at home. For me, that is a no, not so. I'll give myself a zero. Now, I scored a total of 4 points. So, be according to the anxiety scale, I'm at minimal anxiety. But as I said before, I do have a therapist and I have techniques to help myself with the anxiety and with the depression. So, that is being kept tame. Now, if you scored between 5 and 9, you have mild anxiety. And if you scored between 10 and 14, or like I said, anything over 10, you want to just talk to a medical professional and go get yourself some help. Again, you deserve it. Now, I'm going to put the resources in the links below. I'm also going to link the actual assessments and the scoring